All right, ladies and gentlemen, settle down, we are about to start. Thank you very much for coming this evening. My name is Layla McCay, and I run a think tank based in the UK called the Centre for Urban Design and Mental Health. We look at how you can build and plan and design better mental health into cities. And I'm fortunate to be here in Hong Kong, thanks to having an Asia Global Fellowship here at Asia Global Institute, who are kindly hosting us this evening. So this event that we're having is a dialogue that brings together all of you from architecture, planning, geography, health, all variety of things. And we've had these events in Washington, London, Tokyo, and you are our fourth city, so congratulations. Here's the plan. I'm going to give you a bit of an introduction, then we're going to have 5 talks that are each about 5 minutes long from Hong Kong people from various different ways. I'm getting some upset faces over here. What's going on? You're not talking to me? Okay. Sorry about that. So 5 different talks from 5 different cool people from around Hong Kong. Then I'm going to talk about some barriers to progress that I've found from my brief research here in Hong Kong. And then, as though that was not exciting enough, we're going to have a mini film premiere of a 2.5-minute film, and then questions, and then drinks. So I'm just going to briefly start by making sure we're all on the same page about what mental health is, because we're all from different disciplines. And it's important to remember that mental health is not just about not having mental illness. It's also about being able to enjoy your life, being able to cope with stress, work productively, and contribute to your community. And if you think about that from a city perspective, that's also what you want from a resilient, thriving population. But it's not always what you get, because cities can either be good for your mental health or bad. And we know that there's more depression in cities, more anxiety, double the rate of schizophrenia, and more of certain drug use. So what is going on? Some of it is just that the sorts of people who are at risk of mental health problems tend to be more, there tends to be more of them in the city, because things like poverty and unemployment are the sort of things that bring some people to cities, but they're also at the same time risk factors for mental illness. But for our purposes here tonight, I think that these are the 2 particularly interesting things: stimulation and protection. In cities, we are very, very overstimulated. Everything we look at or hear or see is trying to make us think or feel or act in a certain way. And all of that can become overwhelming, especially when you couple it with all the people that we encounter every day. But also, the reason that we don't develop mental illnesses, or one of the reasons, is that there's lots of things that protect us from mental health problems. So what are those things? This is a fairly new field, so the research is still emerging, but at the moment, these are the things that science tells us are protective factors for mental health in the built environment. One is green space and access to nature. Then, designing to improve physical activity, reducing air pollution, designing spaces that encourage positive social interaction, safety in terms of crime, but also in terms of traffic and in terms of wayfinding for people with dementia, and sleep quality. These are the main things. They're not the only things. And over the last 3 months, I've been doing research here in Hong Kong, where I've been speaking to 20 urban planners, designers, architects, geographers, even a journalist, to find out more about urban design for mental health in Hong Kong. Here's the top concerns that people raised. In terms of mental health, what people care about, according to the people I spoke to, is stress, suicide, and dementia. And in terms of urban design, the things that people think about when they think about mental health are density, open space, nature, housing, and homogeneous or generic design. So, given the particular time that we have right now, and the need for our first speaker to depart rather promptly, I am going to skip the first bit and come back to it, but let him speak.